So welcome back to our channel All Round Health Talk. Today we're going to continue our series on sexually transmitted infections, talking about HIV/AIDS. So first of all, we want to clarify what HIV means. HIV means human immune virus and AIDS means acquired immune deficiency syndrome. So HIV is the virus that causes the HIV infection, and the end stage of HIV infection is AIDS. So first of all, we want to know, how is this virus transmitted? What happens in the body? Now, HIV is a virus that attacks the blood cells. Now, we know we have two blood cells, two types, red blood cells and white blood cells. Now, the white blood cells are the ones that are in charge of your immune system. So what the HIV virus does is attack the white blood cells, especially the ones called the CD4 T cells, which are basically in charge of fighting off diseases and infections. Attacking these white blood cells, it causes your immune system to fall, to drop, and that increases your risk of getting other infections, which we call the opportunistic infections, which means these are infections that would normally not affect you if you're healthy, but once your immune system drops, they will take advantage of that and attack your system. So that's what happens. Basically, we say that HIV patients do not die from the infection. They die from the opportunistic diseases that accompany the low immune system. Now, people can have HIV infection and not show symptoms, but still, be it that they are showing symptoms or not, they are still capable of transmitting the virus to other people. So how do we transmit these infections? We remember that your body would produce antibodies to the presence of the virus. This would take 3 to 6 weeks, sometimes up to 3 months. These antibodies that are present in your bloodstream doesn't mean that you have protection. In HIV, it means that you have the infection. So in other diseases, antibodies show that you have a protection against the infection, but in HIV, it's otherwise. So you could get HIV disease from sexual intercourse that are not protected, be it vaginal, oral, or anal, be it heterosexual or homosexual intercourse. You could also get it from blood-to-blood transmission, be it transfusion with infected blood or having direct contact with infected blood. You can get it also if you're a drug user. If you inject drugs into your vein, it increases your chances of getting HIV, and it could be transmitted from mom to child during the pregnancy, labor, delivery, or breastfeeding. Now, there are 3 fluids in the body that carry the virus: the semen, the cervical, and the vaginal secretions. So it's important for us to state that you cannot get HIV by hugging or shaking hands with someone who is infected, by sharing utensils with them, by sharing the same bathrooms. You cannot get the disease by using the same phone, kissing somebody who is infected, or talking to them or breathing around them. You cannot get the disease. So let's stop stigmatizing people with HIV, and I hope you stay tuned to watch the rest of our video on symptoms, diagnosis, treatment, and prevention.